you get that, Mike?
Got that.
Okay. Take that back and show that to the PTs that are doing it. They can call me if they want to talk about it. We'll talk about it. I'm all about, let's talk. We're not going to argue. We're going to talk. We're going to have a discussion.
Yeah.
Okay? All right. Here it is one last time. Did you see that?
Mm-hmm.
She felt it. It's very specific right back here, right?
Mm-hmm.
Okay. Rotate to side bend. It's in there. I'm going to show it to you. I almost took it out of the book, but I'm going to go ahead and leave it in because it's a really kind of cool way to see if C1 is translating left or right. Remember what I said. When you turn your head, rotate to the left, C1 should translate right. Get your finger. This one. Got it, Mike?
Mm-hmm.
This one, Mike. Okay. You can feel with it better. You could just feel better with it. Trust me. And you're gonna go. In fact, let me just show you this side. Okay. The jaw line. Okay. The bone. SCM. Right in between them, there's this little divot. Okay. Do not jam your finger in there. It does not feel good. Don't push hard. Can you feel things with you push hard, or if you just lighten it up a little bit? Just lighten it up, you're going to feel more. Okay? Right there, right off the earlobe, right there. Okay? Okay, relax. And all you're going to do is rotate them just a little bit. There I feel it. Now I don't. There I feel it. She can tell. She's nodding her head. I'm on it. I'll push a little harder, and she doesn't like it. It's very subtle. You've heard me say, think through your hands. Sometimes a patient will be talking, and I'm not even listening because I'm thinking so hard through my hands. I'm like, okay, I really get intense like that. My wife hates that. She married me. She should have thought about that before. Just kidding. I go to the other side. Okay. Relax. Very subtle. I don't feel it as well here. Okay. Right? Could you tell that?
Yeah.
Relax. Yes. I feel it more here. Okay? The guy in Pittsburgh, I could tell his was already sitting a little more lateral in the right. I pushed in and I'm like, wow, it's right there. And then I went over here and I'm like, it wasn't even there. Generally you shouldn't feel it. Now in some people you can, both sides. But if you feel it really prominent on one side and not on another, that's a good indication that on the side that it's more prominent, it's translated that way, correct? Mm-hmm. Okay. There's a press technique for that. There's two ways to do it. If C1, I'm going to go ahead and show you this way because most people are there. But if C1 is not moving this way, it's not translating to the left. It's this test here. I rotate right, correct? Okay, so say I didn't feel it here. Okay? You can do this technique. You can get them in a little cradle. Your arm comes right below the ear on the occiput. Here. Roll them onto your arm. Capture their head with your chest, your body. Okay? Pull her to you, which side bends her to the left, does it not? Subcranially. If I subcranially side bend her to the left, C1, I'm facilitating it to go left, right? That's the way I want it to go. Then with the pad here, on the other side, I press. Press. She's tender on this side. Okay?
Show me where you're pressing at.
right where I have my finger,
Okay.
where I was palpating for.
I thought you said
No, I didn't.
don't put pressure on that.
Huh?
I thought you said don't put pressure on that.
Not when you're palpating for motion,
Gotcha.
but when you're doing the technique,
Then you're pressing it.
and what I did is I didn't use this portion of my finger that we used for the first rib and the facet. I supinated just a little bit to get this meaty portion. That's not medical. Okay? Why? Because I know it's tender, so I just want to press with as much cushion on my finger as possible. Okay? So for the palpatory assessment, you don't push very hard because you can't sense it. For the treatment, you press it. Does that make sense?
Mhm.
Okay? So if you don't want to get someone in a cradle lock like that, that's fine. You don't have to. You can subcranially side bend her, which helps facilitate C1 to go the direction I want, correct? That way. And then come in here and press. You can do it that way. I didn't show you that technique, but that's another way to do it.
Do it the other way.
Okay? So if I want C1 to go that way, I can subcranially side bend her. It's right here.
Mm-hmm.
Okay? And I can